Dramatic weather changes trigger flus, viral infections, typhoid and many other life-threatening diseases. We had to capitalize on the influence of weather on public health to drive the message that regular hand washing can help prevent communicable diseases. Introducing the predictive bellwether. This predictive self-learning AI model predicted outbreaks as a function of weather transients with almost 75% accuracy 3 weeks prior to actual onset. When an outbreak is predicted in a given city, contextually relevant advertising is run on YouTube and Google Display Network in that geography, alerting consumers on the importance of hand washing with soap as a preventive measure. The campaign reached 50 million unique audiences with an incremental ad recall of over 21% and brand favorability of over 19% when tested for control versus exposed. Lifebuoy also witnessed a 19% sales gain. Leveraging the power of search signals and predictive analytics, the predictive bellwether is a step towards empowering Indian mothers to ensure that their kids fall ill a little less often, bringing people one step closer towards healthy and safe India.
This year's Mahakumbh in Allahabad apparently preceded the 2019 Lok Sabha elections. Elections were on top of mind for every Indian. Lifebuoy, the largest selling hygiene soap in India, recognized this fact and decided to do something to help curtail the spread of disease through the simple act of hand washing before meals. We used this opportunity to communicate voting of good health. Lifebuoy became the Sehat Sehbhagi, hygiene partner to the entire Mahakumbh. We partnered with Amar Ujala, a leading media group in UP, to help tie in with the Kumbh authorities and drive the Chuno Sehat, Chuno Lifebuoy campaign on ground and in media. To enable good health during Kumbh, we developed a hand wash zone with a unique EVM hand wash dispenser. The dispenser was an exact replica of electronic voting machine and had 5 good hand washing habits illustrated against each voting button. Every choice made was a vote for health. Lifebuoy hand wash zones were set up at popular akhadas and food courts at the Kumbh, strategically placed just before pilgrims entered community halls and food courts, providing them with a facility to wash their hands. The hand wash zone had Lifebuoy representatives dressed as party workers, introducing people to Lifebuoy Chuno Sehat campaign and offering visitors a unique hand washing experience. Devotees chose the button of their choice on the EVM, with all buttons proclaiming healthy hand washing habits. After completion of the hand washing, devotees got their forefinger inked, signifying their vote for health. The impact on brand scores were proof enough. Millions of votes for health were delivered through this unique Lifebuoy EVM dispenser. Lifebuoy successfully got one of the largest human congregations on earth make a vote for good health.
India's infant mortality rate is 13% higher than the global average. Half of these deaths are caused by preventable diseases like diarrhea and pneumonia and occur in rural areas. Introducing Lifebuoy's Infection Alert System. Our solution was to create a data-led infection alert system to help Lifebuoy proactively educate consumers when they are most vulnerable to fatal diseases, and activate it through mobile, which has the highest reach in rural. Fueled with Government of India data collected from 34,000 rural community health centers across 822 villages and sub-districts, the proprietary algorithm simplified big data to help understand the intensity, magnitude and trends of each of the 21 communicable diseases at a weekly level. Modeling historical data on these diseases, we derived a predictive incidence rate. When an outbreak was predicted, we activated an automatic calling system that made on average 8 million calls every week, alerting rural consumers textually on the prevalent disease in their village and educating them on the importance of hand washing with soap as a preventive measure. Over 55 million such hyper-localized infection alerts covering 21 communicable diseases were delivered to over 20 million families. In these states, we saw a drop of 1,78,000 cases in the top 5 diseases. As brand health tracks rarely have a rural panel, an increase in brand penetration is our best indicator to business success. This is a great example of how we combined mobile, data and technology to create a one-of-its-kind geo-targeted, data-led adaptive marketing solution for rural India.
Life was strong, है जहाँ पे मारी